Well, to our next story, they're mentally and physically burnt out from sheer exhaustion. Working in an already overburdened healthcare system, earlier this week, doctors painted a grim picture of the crisis facing our public hospitals. And now we turn to the brutal reality facing our nurses. They're at the coalface of the pandemic. Lerato Makautu from the Tele Mogarene Regional Hospital joins us now from Ekurhuleni. Lerato, I remember during the first wave, everybody was feeling enthusiastic because they wanted to help people. The second wave, they were getting sick. You may have been vaccinated, but do you have the energy to deal on a daily basis with the absolute overburdened system?
Thank you so much for having me. First of all, we are burned out, like you said, and we definitely were not ready for this. And, we keep on hearing that, we are ready, we are ready, we are ready, but we keep on being burned out. We work where there's shortage of staff. We work where, we have to improvise, where we have to stretch over ourselves, over the limits. We are stretched out, we are burned out. And really, it's very sad to see most of our health workers burned out. At times we actually leave work having to have not even eaten because we really want to take care of our patients. We really want to, get things done. We really want people to be well. And, our patient is our first priority. And with that done, we actually getting burned out. We actually tired. We really have stretched ourselves over, and it's so sad. It's so sad with these influx of patients and everything. We are really burning out. Your nurses are tired. Your doctors are tired. We are tired. We are tired.
Lerato, I can actually hear it in your voice, the way you emphasize the way your exhaustion levels. You told us earlier that nurses don't feel recognized as healthcare professionals by government.
Absolutely, we are not recognized. I feel as if South African government is the only government that doesn't respect their healthcare workers. We're seeing over other countries that they're giving their tax exemptions, they're getting recognized for it. We are not. We absolutely not. We're not being recognized. We're just hearing thank you, and that's it. But thank you is not going to heal our burned out bodies. It's not helping us in any way. We understand that the communities are grateful and everything, but the government isn't recognizing us at all. And it's so sad. It's demotivating.
Lerato, take us into a day in your life. Take us onto a high care ward floor. What are the patients' challenges, and how are you dealing with them?
Okay, so I was working in high care previously. Right now I'm in theater. So I can tell you about high care. I was in high care during the second wave. So, with high care, the ratio of nursing a patient is 2:1, meaning it's two patients to one nurse. And already you can imagine we're supposed to do a total patient care. We're supposed to do everything for that patient, and it's two. So imagine having, one positive patient and one patient who isn't COVID positive. You have to actually protect the other patient that's not infected with COVID at the same time. That meaning doping and dosing of PPE. That means, changing, you protect yourself as well during that process. And at times it gives you the anxiety. We get anxiety with it, it's just too much. And sometimes it's mentally depressing for us seeing your patient actually deteriorate through it. And we are not supported through it by the government. And, right now working in theater, we're operating so many COVID positive patients. We need to keep the theater as well very clean. We need to keep it sterile. And the nurses are doing their utmost best to doing that. And like I said, we're working where there's shortage of staff, which means we overstretch ourselves. And by the time you get home, you cannot, bond with your family. You cannot, sometimes we don't even stay close to our families because we are afraid of infecting them, because we never really know, are we infected or not, because we spend so much time. We are exposed more than 15 minutes to these patients. Because, if I'm in theater with a patient who's COVID positive, we know that the minimal exposure should be 15 minutes. But I'll spend like an hour in the case with that patient. So really, we are exposed, we do get sick, and really we can't be absent, just because, you know, you have, you know, just mild symptoms, you know what I'm saying? Like you're having body pains. I can't stay absent because my body is in pain, because I need to think for my colleagues as well, who I need to, you know, who are relying on each other. We rely on each other so much that, you know, even the staff is becoming COVID positive as well. Like I said, our biggest problem is shortage of staff as well. So we are tired once again, I'll say that.
Larato, a grim picture there, and so many people I've spoken to who've survived COVID with severe conditions have said it was the nurses who, when they ran out of airtime, the patients ran out of airtime, and they were desperate to talk to the families. It was the nurses who used their own airtime so that they could video call or even just chat to their loved ones because they were so isolated, sitting there in their beds. It's you guys who are the ones that are dampening down and cleaning patients and making them feel that they have some dignity left. So we can only thank you, and I know it's not enough. It may seem like an absolutely empty gesture, but my heart goes out to you, and thank you.